and this I'll skip. 5 minutes on questions which can be asked on acute retention, urinary retention. First, the definition. What is acute or what is urinary retention? It's a total or partial involuntary inability to evacuate the bladder. Unless you kind of by heart this line, you will be giving me various answers. So just know the proper definition. Total or partial. Total means acute retention. Partial means chronic retention. Inability to evacuate the bladder. In a normal person, once he has emptied the bladder evacuation should be complete. And these are again definitions. Inability to pass urine with a palpable, painful bladder, it is acute retention. It is associated with sometimes overflow incontinence because bladder can't empty. So it will overpower the closed outlet and then you will start dribbling. So that is overflow incontinence. And usually the people will have prolonged LUTS or blood outlet obstruction history. But if it is acute, it may be a stone. Stone which has dropped from the kidney and stuck in the bladder neck or mid-urethra. So generally the other causes will have a history. Chronic retention is, there are various definitions for chronic retention, but at the moment the accepted definition will be over 300 cc of urine after passing urine associated with non-tender palpable bladder. So some people define it as if you have more than one third of urine left inside the bladder once you have emptied your bladder. So there is no hard and fast definition for chronic retention. This is the accepted one. Generally, the bladder has a large capacity and they are low pressure bladder and they have a LUTS. And nocturnal disease, if it is there with chronic retention, you have to be cautious about this high pressure chronic retention situation, which is not a common situation. Management principles, as you know, acute retention, this can be asked at Viva or the long case if time permits. You start with home remedies till the patient is brought. If somebody gives you a call saying that I'm in retention, and then catheterization will be the hallmark of treating this acute retention. And if you ask what are the steps of management, rather than telling that I will give analgesics, I'll give pethidine, I'll give NSAIDs, rectal. If somebody asks what is the treatment for the pain of acute retention, the answer will be catheterization. So when you catheterize the patient, as soon as possible, the pain will go with it. So first priority is catheterization. And then after the catheterization, you decide on drug therapy or surgical therapy according to the disease. Chronic retention generally doesn't need catheterization because it says that the patient empties his bladder, but he feels that something is left there. Ultrasound proves it. And what you have to do is to train him to empty that retaining urine. If the upper tracts are safe, there is no renal failure, then you do bladder retraining and then catheterization only if it is complicated. In chronic retention, if there is suprarrenal infection, stone formation, or acute on chronic retention, you have to catheterize. But otherwise, remember, most of the chronic retention patients doesn't need catheterization. And then you go for definitive treatment if like BPH or a stricture is there. Catheterization indications are, I think we should go through the pocket guide given to you during your appointment. Those indications and methods are all given in detail there. And occasionally, steps of suprapubic catheterization is asked. These are all YouTube videos you can watch. You can later on you can have a look. But know these things not only for you can see that confirmation of the presence of bladder, and then giving the local anesthetic. These steps, of course, leisurely go through them, and I think I'm going to skip them actually. See whether we can move on. I'm sure this is been done during your training program. An important thing is this part that you have to make sure that you are aiming towards the, actually you must aim towards the anus downwards, and then when the urine comes out, put the catheter there and pull out the sheath and then peeling off. That is the part, because you will be shown actually this part at the vivas, and then you will be asked what are the parts at the oskies and things like that, ospies. And let's move on. Yeah, okay. And I'm not going to go through these things, but literally, when you're recording this, so go through these videos, and these are all YouTube videos which have been incorporated. Self-catheterization technique you have to know. And let me move on. Catheterization and the types of catheterization, complications. I'm just for the sake of completion, I have included this. And there are some MCQs and OSCEs. I think we don't have time to go through those, and maybe at a later occasion we'll discuss all these things. So that will bring us to an end of this discussion of LUTS and retention. It is superfluous to ask if there are any questions. Are there any questions? I don't think you are awake enough to, your brains are all dead now, I know that. Hello? At least you can talk now, is it? Are you all with me?
I can hear you, sir.
Oh, we get right, okay.
Yes, sir.
So, many people have already gone for their buses and, probably their tea and things like that. So anyway, if there are any questions, you can either post it to me or send the SMS or whatever it is, or email. Okay, then. It's nice to have you all around, and then hope you benefited about this. I advise you all to sort of share these slides and then go through it once more to recapitulate your knowledge. Okay, then.
Yes,
bye-bye. Have a good day and stay safe and take care.
Yes, sir. Thank you, sir. You too, sir.
Okay.